packed cell volume, which is also known as PCV, is the hematocrit value expressed as a percentage of cellular elements with that of whole blood. It is a measure or proportion of blood volume that is occupied by the red blood cells. It is the volume of red blood cells packed at the bottom of a hematocrit tube when the blood is centrifuged. Let us look at the method of determination of packed cell volume. Blood is mixed with the anticoagulant EDTA or heparin and filled in hematocrit or Winstrom's tube up to 100 Mach. The tube with the blood is centrifuged at a speed of 3,000 revolutions per minute for 30 minutes. The RBC packed at the bottom is the packed cell volume, and the plasma remains above this. In between the RBCs and the plasma, there is a white Buffy coat, which is formed by white blood cells and the platelets. In the laboratories, with modern equipment, hematocrit is not measured directly, but calculated indirectly by autoanalyzer. It is determined by multiplying red blood cell count by mean cell volume. However, some amount of plasma is always trapped between the red blood cells. So accurate value is obtained only by direct measurement of PCV. Let us look at the significance of determining PCV. Number 1 is for diagnosis and treatment of anemia. Number 2 is for diagnosis and treatment of polycythemia. Number 3 is the determination of extent of dehydration and recovery from dehydration after treatment. And number 4 is decision of blood transfusion. Now let's look at the normal values of PCV. In males, the normal value of PCV is 40 to 45%. In females, it is 38 to 42%. Let's look at the variations in PCV. PCV increases in number 1, polycythemia. Number 2, dehydration. Number 3 is dengue shock syndrome or dengue fever. PCV decreases in pregnancy, cirrhosis of the liver, and hemorrhage due to ectopic pregnancy. Thank you for listening. I hope to see you in our next class.